So we had a beamformer in ReSound 1. In ReSound OMNIA, what we have done differently is now our beamformer is taking into account the torso, the neck, and the head, the whole body that's in there. So think about that for a second. If you develop a directional microphone kind of on a stand in a lab, you don't have all of these reflections off the body and the reflections, head shadow effects, all of the stuff that comes from the acoustics of the head. What we've done is we've decided to use a lot of our chip's processing power to do a lot more math. The engineers will tell me it's 16 more coefficients, Laurel. Not exactly sure what that means. But the outcome is that we can more precisely cancel the noise that is coming at the patient. So we developed our beamformer with basically the patient's body in mind, and we are going to cancel noise much more accurately. And this is where it gets big. So ReSound 1, again, this is our first beamformer. If you compare omnidirectional performance to directional performance, it was called ultra focus in ReSound 1, we had a 4.25 dB improvement in signal-to-noise ratio. So that means that the signal that's in front that the patient wants to hear, we give it basically a 4.25 dB boost. So that's a nice boost. Think about your Quickson results. Think about your hearing in noise. Think about a patient's signal-to-noise ratio loss. If their signal-to-noise ratio loss is only, 6 or 7 dB, you're bringing them back with ReSound 1 to pretty good performance in noise, almost what a normal hearing person would have in noise. All right, so now let's look at front focus. This is ReSound OMNIA, and it's an astounding 8.61 dB. So this is a huge difference. We're almost at 9 dB signal-to-noise ratio improvement. So we're making what that patient wants to hear so much clearer. We're taking out so much more background noise. It's almost, it's almost unbelievable. And that's actually what I told our head of research. He came and he said, our models are telling us that with this new beamformer, where we're taking everything into account acoustically for the patient, that we're getting a 5 dB improvements over ReSound 1. To which I went, no way. I mean, how can you be doing that? It really is astounding until I started to look at our individual patient results. The blue is Omnia, the orange is 1. And this is just 15 patients that we brought in kind of right after research finished up. There's only one patient here that didn't get a significant difference. And that patient has some other issues going on anyway. So this is really astounding. I mean, look at these individual results. One of them, 13.15 dB signal-to-noise ratio improvement. Because remember, what I'm showing here is omni minus directional. So these are improvement scores. It is absolutely astounding individual performance here. This is what you're seeing. This is what you'll hear if you go listen to that demo. Hopefully, I know few of you have actually been wearing these hearing aids around. So you're hearing what it is like. It is really easy to tell the difference between ReSound 1 and ReSound OMNIA with hearing and noise. So let's go back to the averages. The averages, we have an improvement over ReSound 1 of 4.36 dB. So it's almost 4.5, let's just say. It's almost 4.5 dB over ReSound 1, which was already a beamformer and already doing a pretty good job. We're 4.36 above that. And that's 150% improvement. So you ask me, how the heck is that 150% improvement? Well, think about how decibels are measured. And if you double the power, it's a 3 dB increase. So we have a 3 dB increase, that's a 100% increase. And another dB and a half is a 150% increase. And if you need a little refresher course on how decibels work, all of you are very familiar that if you go into a noisy situation, You can be there 85 dB, you can be there for 8 hours. And if I go up 3 dB, so I'm doubling the intensity, what happens? I half the amount of time you can spend there. So 3 dB is the 100% increase. And so in order for us to have 150% improvement, we need to have a 3 dB improvement plus another dB and a half. So we're improving that signal to noise ratio over ReSound 1, 4.5 dB. Another way to think about it is not just in the speech understanding score. It's how much extra noise are we taking out of the background. So I like this one. I kind of got the idea of this because if you follow the news at all, you know Lake Mead has, you know, a lot of water is not in that lake anymore. And there's some interesting stories about what they're finding on the bottom of that lake. A few bodies, they think mob connected and stuff. They've actually recently found a World War II era boat at the bottom of that lake. So there's all kinds of things that are happening as that water is draining. So let's just say, you know, the water was at 9 meters. I'm just making this up. As the water comes out of that lake, you start to see these interesting things on the bottom. And so I went down 3 dB, or actually 3 meters in my example, and another 3 meters, I actually even see more. The water is noise in this example. I'm taking out more noise. So if you go to our hearing aid and say, okay, our hearing aid is omnidirectional at 12 meters, and at 7.5, that's ultra focus. That's ReSound 1. So ReSound 1 took out so much. ReSound OMNIA takes out even more. And so you can think about that 150 dB in however you want. It is either an improvement in signal-to-noise ratio, or it's how much extra noise you take out. You can use them conversely like that, because that's what happens. You take out the noise, and the score will improve. So hearing and noise is going to be dramatically different with Omnia. For those of you who like to see the directivity index, that's what I'm showing you here. The blue, the dark blue, is ReSound 1. And you can just see how much more directional per frequency the directivity index here. But one thing many of you will notice is, well, why is it only directional in the mid-frequencies? And I'll just lay out that we are really one of the only companies doing directionality like we do for many good reasons. The mid-frequencies, of course, is where speech understanding happens. So that's where we want the beamformer. So all of that great improvement is in the mid-frequencies. Above 5,000, we actually don't use that kind of adaptive beamforming anymore. We're going to use a fixed directional above 5,000. And why would we do that? We would do that for localization, because we want the patient to be able to localize and hear and preserve all of those good localization cues that are out there that really aren't a part of speech intelligibility. And then finally, in the low frequencies, we keep everything omni. So we don't even do directional in the low frequencies. There's a really good reason not to do directional in the low frequencies, and that's shown on this graph. So this graph is what's called the proximity effect. And what the proximity effect is it's the sound of your own voice. Your voice is so close to the microphone that your voice becomes very, very loud. But that only happens in full band directionality. So what you're seeing here is full band directionality. This is directionality going from the lowest frequencies all the way to the highest frequencies. And you can see that the closer you are to the microphone, so 5 centimeters away versus 10 versus a meter, you actually have a whole lot more gain in that lowest, or in that closest measurement. And so that's the proximity effect. And so some companies have, own voice processing and things to fix this. Well, guess what? We don't have to fix it because we don't have the problem. So voice sounds good, you're already omnidirectional. So in Omnia, you will have very natural own voice along with great directionality, along with great localization and the ability to hear all around you. I will kind of talk a little bit about competitors real quick. How are we different from everyone else? Well, you have companies that are still using 2-microphone directionality. So right there, that's a big difference. 2-microphone directionality will never give you the signal-to-noise ratio improvements of a beamformer or 4-microphone directionality. But if you look at companies that are using 4-microphone directionality, we are the only company that also can hear 360 degrees around. So when you look at the whole picture, this was what we wanted to get to. This was that vision that we looked at all the way back from Azure. And yep, we've come along the way. We are a company who takes risks. Like Ryan talked about today, we've taken a ton of risks as a company. You have to risk in order to have leapfrog kind of things happen in your hearing aids. And so we've taken the risks. We've worked on this for years. And again, this is the culmination. You can get a Marie microphone on Omnia. I would encourage you. And one of my most favorite things about the new software that Miguel is going to talk about is that our software is now going to tell you the most appropriate receiver for the hearing loss. So I know when we first came out with Marie, it was maybe we weren't very good at telling you, okay, this is a Marie candidate and this is not a Marie candidate. And now it's going to be right in the software. And when you look at Marie, we consider this the gold standard. Marie will give you things that you cannot get with a standard receiver. All of them I list here: increased wind noise reduction, improved localization, natural sound because you're using your own ear and your ear's acoustics. If you're using a telephone the old-fashioned way, instead of streaming it, just putting it up to your ear, you don't have to fumble around looking for where the microphones are. Crystal clear phone call placements. People love Marie for regular phone call taking. And finally, we have studies now that show that a standard receiver versus our Marie receiver, the listening effort is much easier with the Marie receiver. And one thing I'll just highlight is there is nothing that gives you depth to spatial perception other than the Marie receiver. So patients don't just have to hear the sound right in front of them. They will hear the sound with depth. They know that it's far away and they can hear it where it's originating, and that is not traditional. So you put all of these things together in an Omnia, and there's just no hearing aid that can provide everything that ReSound OMNIA provides.